Hi everybody, my name is Andy and this is my population level health education intervention presentation. So first we have the introduction. My city of choice was City Heights, San Diego, the 92105 area. And the four health concerns that I chose to focus on were obesity, diabetes, physical and mental health, anxiety, depression. Background and significance. The windshield survey, from what I gathered, showed an overweight population, minimal physical exercise, and saturation of unhealthy and fast foods in the area. The U.S. Census Bureau gave information saying that out of the almost 70,000 people in City Heights, 54% were Hispanic, and the median household income was actually only 37,000 a year, which puts 28% of the population below poverty line. And then the CDC follows up using those statistics by saying that since the population is high Hispanics, of Hispanic background, that they're actually at a 23% higher rate of obesity than Caucasians. While Hispanics do have a lower death rate overall, they have a 50% higher death rate from diabetes. Specific Hispanic health information says that about 1 in 4 Hispanic people live below the poverty line, and 1 in 3 has not completed high school. And the National Alliance for Mental Health specifies some common Hispanic mental health issues. It's that common mental health disorders for the Hispanic population are generalized anxiety disorder, major depression, PTSD, and alcoholism. And as a community overall, the National Alliance states that Latinos are less likely to seek mental health treatment, and out of those people, only 10% contact a mental health specialist. So the objectives for these 4 issues that I'm covering by the Healthy People 2020, the first one was for nutritional and weight status, and one of the goals that I thought was most important was increase the proportion of adults who are at a healthy weight. For diabetes, it was reduce the annual number of new cases of diagnosed diabetes in the population. And for physical activity, it was increase the proportion of adults who meet current federal physical activity guidelines for aerobic physical activity and muscle strengthening activity. And for mental health, it was reduce the proportion of persons who experience major depressive episodes. The needs assessment. So to gather the information for my needs assessment, I utilized many different avenues. I utilized my windshield survey, which I covered a couple slides ago, basically driving around, taking pictures, and collecting information based off of what I saw from my windshield. I did a lot of research on the Center for CDC website. Based health, and then overall based health, as well as socioeconomic based health concerns. Healthy People 2020 gave me a lot of information about objectives and interventions. The U.S. Census Bureau gave me a lot of information about my specific area, City Heights, that I would be covering, more specific than what I was able to gather from just the windshield survey. And then the NAMI website, which is the National Alliance for Mental Health, had a ton of information on, again, overall population concerns and necessities, as well as ethnic and socioeconomic concerns. I also utilize my interviews. So for City Heights, my population stakeholder, Juan S., who is a resident of City Heights, and my key stakeholder, Chelsea P., who was a registered nurse at a community clinic in City Heights. So for my model that I used, we used the Precede Proceed model, which is 8 phases that were divided up to help us kind of prepare for this presentation. So I'll briefly go over each phase. Phase 1 was defining the ultimate outcome, and my ultimate goal is educating people of City Heights on nutrition, diabetic prevention, maintenance, and health promotion, specifically on nutrition, exercise, and mental health and diabetes. Phase 2 is identifying the issues. So certain issues that affect the health concerns of this population are culture, lifestyle, behavior, and environment. They contribute to the City Heights people overall risk for these medical issues. Phase 3 was examining the factors that influence behavior. So lack of access to health education, lack of access to nutrition, cultural norms, and financial status are some of the factors that influence these behaviors and responses. Phase 4 is identifying the best practice. So I decided that creating a culturally centric education presentation that utilizes the targeted population's language, traditional foods, and accessible fitness plans, as well as taking into consideration people's baseline by utilizing pre and post tests and not making assumptions about people's health knowledge basis. Phase 5 is implementation. So conducted 2 educational presentations on the 4 health topics while utilizing multiple media tools, including my pre and post test, as well as interactive participation. Phase 6 is process evaluation. I use this phase to help establish a timeline of goals to facilitate the steps to complete the project. And phase 7 was impact evaluation. So during that phase, I developed 8 short-term goals for the presentation. And phase 8 was outcome evaluation, and we were instructed to develop 2 long-term goals for my presentation. So education and practice issues, some barriers and assets for the population of people that I would be speaking to during my presentation. Some barriers, specific barriers might be willingness to change, priorities, as well as lack of confidence and fear. So especially things with diet and exercise, that transcends all race, religion, socioeconomic. There's a pretty genuine fear that happens when people feel like they need to make diet and exercise changes. It almost feels like undoable, for lack of a better term. And sometimes our priorities and our willingness to change can be affected by our current status. So as I touch below on a couple of things like socioeconomic status and education, as well as culture and beliefs, those can all affect our willingness to change and our priorities. If you're concerned with how you're going to make enough money to pay the rent, you might not be willing to take into consideration that you need to take more time to be concerned about your diet, and you may not even have time to exercise. So that's really important, not going into a room and just saying, this is what you should be doing, but actually taking into consideration why people may not be able to do or put priorities and offering them excellent options to address these barriers. Assets, so some skills and attributes needed would be willingness to change. Time management and organization is a huge thing that you would need to have to be able to make these lifestyle changes and receive this information, as well as motivation. So each individual person, excuse my cat, each individual person needs to find the big motivation that happens for them, that can help them to put their health in control, put their priorities of being physically active and having a good nutrition and taking care of themselves so that they don't put themselves at more risk for diabetes. Some nursing and community resources is early intervention, so things like these programs and these classes, and giving clear, concise, and honest education. So making sure that we're telling them exactly what we need them to know and letting them know that they are at risk based off of socioeconomic status, based off of ethnicity, and having patience, making sure we address language barriers with translation and interpretation, and making sure we provide as much affordable health education information that we can. May that be community resources and all sorts of different stuff like that. So intervention. On the left, I restated the goals from Healthy People 2020, but on the right, I'll talk about how I address them in my presentation. So for the goal for nutritional weight status, addressing the goal of a healthy weight by covering diet, exercise, and meal planning. And then I also did an interactive meal plan where I gave the groups options for, a vegetable, a starch, meat, and a fat. And then we kind of helped construct in the group a healthy meal. So for diabetes, making sure we cover diabetes prevention, testing, and maintenance in the education in a accessible, clear, concise, and way that everybody can understand using layman's terms. For physical activity, incorporating regular cardiovascular activity, exercise as part of a lifestyle, and kind of tying in how that can help all the other goals with the education. Mental health, again, creating connections between the physical realm and the mental realm of health, making sure we know that different cultures and different socioeconomic backgrounds may not put mental health on the forefront, but really stressing how mental health can help affect all the other goals, but also all the other goals can help affect mental health. And then utilizing an oral presentation, pre and post test, and participation interaction. Budget and logistics was very straightforward. I had very little cost or materials. I had to use some of my own paper to do the pre and post tests and some printouts for the meal and exercise. And then collaboration with the site and facility director and my proctor, but none of that cost any money. So I guess my money would be from my paper, but since I already had it, I really didn't think about it. So very straightforward. Projects, evaluations, and outcomes. So some goals of mine were the completion of the presentation. Participants will be able to identify 3 modifiable risk factors for diabetes. And then 4, the bottom one, was at the end of the presentation, 75% of participants will be able to score 80% or higher on the post-test administered. So goals in 1 and 4 were quantitative direct goals. They were attained. 100% of the classes actually scored 80% or higher on the post-test. And 2 and 3 were qualitatives. So at the completion of presentation, participants will be able to verbally construct a routine healthy meal from choices provided by me. So the verbal construction of a healthy meal was partially met. It definitely needed more participation. I think that some people were afraid to talk. And then participants were verbally asked to show increased willingness and confidence in their knowledge regarding diet, exercise, and diabetes. I realized during that the goal of willingness was not easily judged. I do feel that overall participants were receptive and positive at the conclusion of the test, but it wasn't a very clear goal. I could have done a better job of that. So some results and conclusions, some weaknesses and issues on my part. I definitely could have done a better job of promotion and increasing the number of participants in each of my classes. And I felt, this is a little bit direct, but my project was a little plain. I felt I could have done a little bit more to spice it up, I guess. And then time allotment and procrastination. Of course, I'm a student and I'm a full-time nurse, so we can always do better about time management and not waiting till the last minute. I think maybe not waiting till the last minute would have helped weaknesses 1 and 2. And I definitely think that utilizing an ice-breaking activity or creating a little more group participation would have been much better. And I addressed the weaknesses and adjustments there. These are my references that I used. I really relied heavily on the CDC, as well as the Healthy People 2020 website. There was a definite information that I collected from some education websites and things of that nature. And then, of course, all my statistics based on the community and the City Heights population and financial status and ethnic backgrounds and race and all of that was collected from the census. And that was really helpful in developing a plan. So that is my presentation. Thank you so much. Hope everyone has a wonderful class.